Joining us live over the phone now to talk about this mystery illness is Dr. Camille Alander of Bond Vet.
Now, Dr. Alander, thank you for joining us this morning. Now, we've been hearing about a promising development here. What do you think about this development? Do you think it's promising that, vets are kind of narrowing in on this bacteria that's already in a lot of these dogs?
Good morning. Yes, I think it is promising. So as you mentioned, there's currently a team of scientists researching this at UNH. Came out over the past week that they found potentially some genetic material of an atypical bacterial series that was common in a small number of samples that they had collected and submitted to them. These samples were collected over about the last 2 years. The sample size that this information is coming from is 30. 21 of those dogs had common genetic sequencing of this atypical bacteria. So while this is promising and encouraging, it is a small sample size, so certainly nothing to hang our hats on at this point, but gives us a direction to kind of go in.
Well, that's good news. Dr. Alander, do you know how many cases there are in Massachusetts right now? And can you talk about what the symptoms are that these dogs are experiencing who do catch this illness?
Yeah, so it's challenging to answer the question of how many cases are there definitively because, one, we don't know exactly what the pathogen is that's causing illness, and two, the symptoms are very typical of our common kennel cough. So without first identifying a distinct cause or a distinct pathogen, we can't quantify or track data on exactly how many cases are present here in Boston or in New England.
Now, doctor, how dangerous is this illness here? I know, Anna, you had some questions for your vet because you were worried about some of the signs and symptoms, but how worried should pet owners be?
Yeah, so for the majority of the patients we're seeing right now, symptoms are including a cough, runny eyes, runny nose, maybe a few of them have a fever, but for the most part, they're still pretty healthy. Serious illness can occur, just like in any respiratory illness, people, pets alike. Typically, the honking cough lasts for a week to 10 days, and then they have a full recovery. There are a small number of pets that this illness is progressing to something more like a pneumonia or becomes a bit more life-threatening, requiring more aggressive treatment. A lot of this is happening in species or breed-specific areas, so we worry more about what we call brachycephalic dogs. Brachycephalic dogs are the dogs with the kind of smushed-in nose, so your French bulldogs or your pugs. Those dogs are more predisposed to respiratory illness just due to their anatomy. And then there are other dogs with additional health issues, so maybe a dog that's going through chemotherapy or a dog that already has lung disease of some sort. Those are the dogs we're more worried about. Serious, dangerous illness.
What should dog owners be doing to protect their dogs? I know that I've been wondering, can I bring my dog to her grooming appointment? Can she say hi to other dogs on walks? What should we be doing right now to keep them safe?
Of course. So a lot of it's going to be common sense, but making sure your pet is up to date on all of their vaccines. So we think about respiratory illnesses being covered by vaccines. Those vaccines we want to make sure are up to date are distemper, canine influenza, bordetella, which might be referred to as the kennel cough vaccine, making sure your pet is up to date on all of those. And if they are going places like daycare or the groomer, making sure that those places require those vaccinations for anybody coming into their establishment, and also that they're enforcing that. If you want to send your pet to daycare, I think that is fine. I've got 2 dogs of my own. They still go to daycare multiple times a week. I know that their daycare is diligent. You can ask them, ask your daycare, do you clean regularly? Do you require vaccines? They'll be happy to answer those questions for you. And if they're not, maybe that's somewhere you don't want to be sending your pet.
All right, Dr. Camille Alander from Bond Vet, thank you so much for your insight this morning. We really appreciate it.